I mean, now it's a fun for you to take care of it. Whereas, expand on that. What do you mean by that?
You know, the treatment of periodontal disease has really changed dramatically in the 20 or so years that I've been a periodontist. When I finished my perio training, advanced periodontal disease was always treated with cut and stitch gum surgery. And people would do it because they wanted to keep their teeth, but nobody enjoyed doing it. No one thanked me for doing it when we were done.
Right.
And it was, although technically it was enjoyable to do, that's why a lot of people become periodontists, it's hard to enjoy doing it when you know that people weren't enjoying having it.
Okay, okay. So now this new laser has changed all that. I mean, is it really that different?
It's completely different
than the way it was before?
It's completely different. You know, before, when someone came in with advanced disease, they'd have a number of visits with a hygienist of scaling, 3 or 4 visits, and then they would have a number of visits of gum surgery, where we lift the gum up from around the teeth. I'll show you in a little bit. I brought some pictures to show you. And now with the laser, we can reverse 20 years of neglect sometimes, or 20 years of disease in a couple 2-hour sessions.
So things like no more bleeding gums, no more loose teeth, no more bad breath. These, I mean, are these truths about what this laser can do?
Yeah,
I mean, not an exaggeration?
Not an exaggeration at all. This laser I found to be as effective or more effective at treating periodontal disease than was the old cut and stitch surgery.
Now, we should talk about your background in training. You're board certified periodontist. You're clinical professor, assistant clinical professor at New York University College of Dentistry?
Yes. What happens is the laser energy first goes into the pocket and it removes diseased tissue but leaves healthy tissue untouched. If I were to take the laser and move it over a piece of newsprint, it doesn't affect the paper at all, but it will remove the ink from the newsprint leaving the paper undisturbed. So the bacteria of periodontal disease soak up light energy very well. So the laser goes in, it kills those bacteria, and it removes the diseased tissue very selectively and doesn't touch healthy tissue at all. It's more precise than any surgeon's scalpel could ever be.
Okay, so the way it's been done, or being done nationwide, okay, is you go in, you cut it out. I mean, is that right? Or scrape it out?
In effect, what we would do is we would make an incision and lift the gum up from around the teeth. Once the gum is reflected, we could see the root of the tooth, and we would scrape the tartar off the root in a hope to remove the tartar, to remove the bacteria. And then we would put the gum back. So it was sort of removing it mechanically. But in order to remove it mechanically, it was very invasive. We'd have to open the gum and ultimately close the gum. And the act of, you know, cutting open the gum, reshaping the bone.
And that's the old way. We're talking about the old way.
Right.
But the old way is being done every day.
Right.
And right? Is that right? Even in Long Island?
It's being done everywhere. And, you know, what's interesting is people always have a quandary. Nobody wants to lose their teeth. No one comes in and says, well, I'm okay losing my teeth. Who would want to go to work, you know, see their spouse, meet their friends, and have half their teeth missing? Nobody. Okay. But people would be so hesitant to do periodontal surgery because they've heard horror stories from their friend or from their spouse that many people really make a conscious or unconscious decision to leave their gum disease untreated because they felt it would be, they'd rather lose their teeth than have that surgery done.
So you have this laser treatment for the bleeding gums, bad breath, loose teeth, all those things. How soon can they be somewhat comfortable with their eating, chewing, things like that?
Well, they're comfortable right away. There's no, you know, we met, 2 days ago I treated a gentleman in the morning and he went to work in the afternoon. So people take a Motrin or a Tylenol after treatment. They don't have the weeks and weeks of downtime or the longer downtime that cut and stitch surgery would have.
Are people traveling a long way to see you? Because you're the only guy that has the laser?
You know, I'm amazed. People are coming from Montauk all the way on the East End, from New York City and everywhere in between, passing, you know, 30, 40 periodontists in between. And it sort of gets to my point that everybody wants to keep their teeth. Who in their right mind would make a conscious decision to lose their teeth? But if it means going through having periodontal surgery, a lot of people just don't want to do that. So it's sort of a way that you can have your cake and eat it too. You can treat your gum disease without having to have surgery.
So you say that there is an alternative than cutting and stitching for gum disease. What is it? You say lasers.
I'm a periodontist. I've been practicing for 2 decades. In the past, we would do deep cleaning, and then if that didn't work, we would go into something called periodontal surgery, which is where you're cutting the gum tissue and then having to suture. Now, patients, even though that may be very effective, patients didn't like it. It didn't provide them the comfort and the aesthetics that they're looking for. There's something called laser-assisted new attachment procedure, or commonly known as LANAP. I'm one of the few in the area, in the Philadelphia region, who's able to provide this for patients. It's a technique, it's a protocol. I'm using a laser, state-of-the-art laser, which is going to evaporate the bad bugs which cause this disease, and it's going to selectively remove the infected tissue. It's not like I have to go
So
in
it's
with
like
a
a
knife.
bacterial infection that is killed with the laser.
Is
that right?
I love it. So what it is, what causes this disease? Bacteria, bugs in the mouth. And when patients hear that, they're like, oh my God, bugs in my mouth, get rid of it. So it's going to absolutely 100% eliminate the bug around the gum tissue and around the tooth. But secondly, this is where it's been so tough in the past. How do you selectively eliminate the infected tissue, our normal gum tissue that's been infected with bacteria, that's got this inflammation going on, without cutting the healthy stuff away? In the past, it was with a knife. Now I can go in with a laser, which looks like a little tiny wand, a tiny little fiber. It's the width of 3 hairs. I can go into the gum tissue, and the laser does all the work. It eliminates that infected tissue. It obliterates the bacteria.
So no more bleeding gums, bad breath?
No more bleeding gums, no more bad breath. Gum tissue looks red and healthy. And get this, not only does it eliminate it, it's actually going to regenerate bone, which is going to make the teeth stronger.
Okay.
And it's going to improve the quality of the gum tissue. It's going to look healthy. And like you said, we don't have the bad breath anymore. The teeth are starting to feel more comfortable.
So loose teeth feel better, they get stronger.
Bottom line.
So no more cutting, stitching, you say?
It's a thing of the past, Randy. We don't need to do that.
There's only less than 10% of periodontists that are using this laser, statistically.
Correct. We have about 10%, according to the American Academy of Periodontology, only 10% are using this. Those are the top 10%. 10 years ago, 20 years ago, nobody was using bone graft. Nobody was thinking ahead
so you love
about
this
regeneration. It is cutting edge. It is where everybody's going to be 5 years from now.
Okay, good.
And I'm forging that at this point.
What happens is, with periodontal disease, the bacteria stay there. So you have this chronic inflammation that just stays there. So what the laser does is it gets rid of the bacteria. It lowers the level of the bacteria so that the body's elements, the healing mechanisms, can be successful. And that's where the regeneration occurs, and the reattachment, and the connective tissue attachment. And this has been shown. This laser procedure is the only FDA-cleared laser for a patented protocol. Okay. This laser has been out for 10 years. It's the only company that actually has the histologic study that shows regeneration and reattachment.
So it works. I mean, it definitely works.
It works. It works for the patient, and the dentist cannot dispute the science.
But it's also made your job a lot easier, you said. You know, in the old days, you would do the cutting procedure for gum disease, which is done, by the way, in Chicago every day. Is that
every
true?
day, all across the country.
Like hundreds and hundreds, though, in Chicago alone?
Yes. I mean, periodontal disease is worldwide,
okay,
but
so
yes, in
no
Chicago.
more cutting. I mean, you shouldn't have to do it with this new laser.
Correct.
Okay. So, but you say in the old days you would do one side of the mouth.
Right.
And you couldn't even get them back in for the other. Elaborate on that.
Well, of course, I wish I could say all my patients came back for the other half, but often after that first experience, patients prefer not to finish. As a matter of fact, the first year I had my laser was the worst of the recession. I had my best year in business because all of my patients in my practice that had refused surgical care accepted the laser treatment.
Here's one in treating gum disease?
Over the last 10 years now, I've been using a procedure known as LANAP that uses a laser to treat moderate and severe periodontitis in lieu of using a scalpel and stitches. Okay. Sometimes there are changes in the spaces between your teeth, which indicate changes in the underlying bone. In fact,
so the teeth start to move?
Correct. Just last week, we had a patient in our office, and she'd come in, and when I sat down to do the exam, she told me just how thrilled she was that she came to see me about a year ago. And we did the laser procedure on her. And she said that her gums had filled in. Now, I questioned it because I didn't remember what her teeth looked like before, but we'd actually taken a photo. When I looked at the photo, she was right. She had spaces between her front 4 teeth. And she was told that she was going to lose all 4 of those teeth. She came to me, we did the laser, and just last week, her teeth had actually shifted back together. It almost looked like we'd done orthodontics on her.
All right.
Her smile had improved, and I wouldn't have believed it if I hadn't seen the picture myself.
What?
No.
No?
The non-surgical pocket reduction is called root planing. The surgery, you know, it can be called flap surgery. It's also known as osseous surgery.
So for people with advanced periodontal disease, the standard procedure is surgery.
Correct.
So they cut away the gums,
they
will scrape.
Correct. They'll make an incision.
All right.
They'll separate the gums from the bone in the tooth so that they can get direct access to the tartar.
Okay.
To remove the tartar, okay, which again is the source of the infection. So they want to get that tartar off of there, and then they'll stitch it back together and probably put a periodontal dressing on it or something like that.
Okay, the other option, that's one, is surgery. What's the other option?
There are several other options. The primary one in my office is a patented procedure known as LANAP. And what we do with LANAP
That's a laser?
That's using a laser to go in and selectively remove the diseased gum tissue and kill the bacteria that are causing the infection.
Is this virtually a bloodless surgery then?
No.
Is it even called a surgery?
Yes, it's a surgery. But it really doesn't seem like a surgery because it's so minimally invasive. And so I've got thousands of patients who are coming in to see me to have their gums treated, and they're coming back after we've treated them to do our periodontal maintenance appointments, and the bleeding is gone, the swelling is gone, the bad breath is gone, you know, and the gums are healthier and the patients are happier.
So you have patients that dealt with bad breath for 10 years plus, bleeding gums for many years.
I've got people who come in all the time, and so often they'll come in and they'll say they haven't been to see a dentist in probably 5 to 10 years, and so you know there are a lot of different issues going on in their mouth besides just the gums. But of course we're going to focus first on the gums, get the gums healthy, because we want to get a good foundation. Once we've got a great foundation, a nice healthy bone, nice healthy gums, and the teeth are now solid instead of loose, now we can build on that.
So loose teeth become a little stronger?
Loose teeth, yeah.
After periodontal treatment?
After my LANAP procedure.
Okay.
What happens is somebody will come in, and I cannot tell you the number of people who have come in and said, you know, the dentists want to take out 6 teeth or 8 teeth or whatever. And we'll go in and we'll treat them, and they keep all their teeth.